Hi, my name is Ethan Barton. I'm a student nurse at the University of South Alabama. Here's my ID. And today I'm going to be performing my NG tube checkoff. I'm going to scan the room. So first I'm going to get my patient care order form and review my hospital policy for the insertion of the NG tube. And I'm going to identify form hand hygiene, and then I'm going to identify my patient using two identifiers. I see this is Jaguar Jones. His date of birth is 8/25/1963, and his date of birth here is 8/25/1963. So today I'm going to be inserting an NG tube through your nose down into your stomach contents. I'll explain more about it as we move along towards the process. I'm going to assess any allergies you might have. Yeah, I see that you are allergic to penicillin. You are allergic to penicillin. Do you have any other allergies? No. Okay. Excellent. So now I'm going to provide privacy for my patient, and then I'm going to gather all my equipment. I have all my equipment in place right now, actually, and I have the tape already pre-cut right here, hanging on the other side. I'm going to make sure to have my stethoscope and my pen light readily available on me, and I'm going to don my goggles. Okay. Next, I'm going to perform hand hygiene again, and then I'm going to raise my patient's bed to a comfortable working height, and then lower the side rail. And then I'm going to use my stethoscope. I'm going to assess my patient underneath the gown, skin, make sure the diaphragm comes in contact with the skin, listening for any bowel sounds, and assessing respiratory sounds. Also, I'm going to be looking at using my pulse oximeter on the patient's finger. I'm going to be looking at oxygen saturation, as well as vital signs. And then next, I am going to with my pulse oximeter, I would look for any decreases in oximetry of the patient, and I would discontinue the NG tube insertion until those have stabilized and returned to normal on the patient. Next, I'm going to establish, so Mr. Jones, today I'm going to, when I'm inserting this tube, we're going to have a sign so that you have to talk while I'm inserting it if you do have any troubles. So please tap on the side of the rail, or you can tap my arm if you do have any problems while the NG tube is being inserted. Next, I'm going to open my NG tube package. Going to get my lube, and I'm going to squirt some right here at the end of the package, and then dispose of that in the trash can. And then I'm going to get my NG tube, and normally I would measure it, but it has already been measured, so it is marked off here with dog-ear tape, and I will show how to measure an NG tube on a volunteer in a separate video. I'm going to place that here, it's already measured. I'm going to get my 60 milliliter syringe and loosen that up. Once I've done that, I'm going to don my clean gloves. And now, after I don my clean gloves, I'm going to assess my patient's snares by including one at a time to assess for patency, and I'm going to insert the NG tube into the most patent nostril, and then I will document this later. Next, I will get soap and water in a rag, and I'm going to wash the patient's bridge of their nose, and then put that cloth to the side, and then I'm going to grab another cloth that's dry, and I'm going to pat dry their bridge of their nose. Next, I'm going to have my tape right here ready for taping on the cheek, and also make sure I have my tape for connecting it to the bridge of the nose. I'm going to get my towel and place it on my patient. And then also make sure to have a basin on their abdomen for the secretions of the stomach. And then now I'm going to get my NG tube, coil it the first 4 inches around my fingers tightly, and then I'm going to release that. After I've done that, I'm going to dip the end into the loop that I've set aside, just the first 4 inches. Then after I've done that, I'm going to insert this into my basin, and then I'm gonna ask Mr. Jaguar Jones, please tilt your head back, and I want you to, I'm gonna have a cup of water for him to sip on as I'm inserting this tube, and I do encourage you to swallow as I am inserting the tube. You're gonna feel a little discomfort. Please remember this signal that we established. All right, so take a deep breath, and we're gonna insert into the nair slowly until we're into the nasopharynx. And then also, if he feels any pain or comfort, then I will pull back until the posterior nasopharynx until he is better, and also check for his pulse oximetry. And then after it's into his nasopharynx, I'm asking his head to tilt forward, and then I'm going to insert all the way until the marked spot, not pushing against resistance and forcing it. Once I've done that, I'm going to get my temporary piece of tape. Tape that to his cheek. This is just temporary. And then next I'm going to attach patient's NG tube to the cheek. Next I'm going to assess the placement of the NG tube in the back of the throat with my tongue blade. So ask him up his mouth and inspect that. And then I'm also going to get my 60 milliliter syringe and attach that right here. And then I would aspirate the contents of the patient's stomach, looking for the gastric contents. I would assess the pH if need be, and then also we would get an x-ray of the patient if need be to make sure that we have correct placement of the NG tube. Gonna place that back into my basin. If need be, I could connect the I could connect my NG tube to suction, excuse me. And I would do this by keeping the pigtail above the patient's, preferably on top of the patient's bed. Make sure the pigtail is above the abdomen, and attach that to intermittent suction, and adjusting that at the wall as need be. Also, now I'm going to remove the temporary tape, and I'm going to get my permanent tape that will be on the patient's nose. I'd also like to note that I will be marking take the tape off after I've marked the spot where I've inserted the NG tube for later on assessing if there's been any movement of it. So next I'm going to take away this tape. This on the bridge of the nose. Then make sure that my NG tube is floating. Like so. And make sure this stays stuck on his nose. Allowing for slack so he can turn his head from side to side according to the hospital procedures. Then I'm going to clip his NG tube to his gown so there's less room for movement, and so the tape would not come loose. And then after I've done that, so the patient is in high Fowler's currently, I would then lower the patient back down to no lower than the head of elevation of 30 degrees. I would set the side rails up, and I would lower them to their lowest position and make sure that the patient is positioned comfortably. And then after I've done that, I would clean up my supplies. So I make sure that everything is together, and I would dispose of this normally, and then I would remove the towel from the patient, and then I would remove my gloves, downward to the trash can, go off the gloves, skin to skin, and then I would perform hand hygiene. Then I would document the insertion of my NG tube, such as the type and size of the NG tube, the time that I placed the NG tube in, the location, so which nair I put the NG tube in, how the patient tolerated the procedure, as well as the color, consistency, and the characteristics of the secretions from the patient's stomach. Next, I'm going to move on to showing how to properly discontinue an NG tube by first checking my order, and then performing hand hygiene, and then moving to the patient. I would now explain the procedures to the patient. So, Mr. Jaguar Jones, today we're going to be removing your NG tube, and then after I've done that, I'm going to don clean gloves. And after I've done that, I would then, once again, pull out my stethoscope and assess the bowel sounds, seeing if the suction is, after I've assessed the bowel sounds, I would see if there's suction present on the NG tube. I would turn that off, and then I would unclip the tube from the patient's gown, and also, holding it steady, untape the tube from the neck. From the nose, and then after I've done that, I would going to demonstrate kinking the tube back on itself. And then once I've done that, I'm going to warn Mr. Jones of me pulling it out. I'm going to say take a deep breath, and I'm going to pull out steadily, 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 until it is all the way out. Then once I've done that, I would dispose of it properly. Now, I'm not going to do that today because of later on use. Next, I'm going to look at the drainage, see the amount of drainage that is come from Mr. Jaguar Jones. I would clean around his nair if any secretions might have come down and gotten on his face or anything. And then after I've done that, I'd perform oral hygiene on Mr. Jaguar Jones, and then I would then document the process. Then after I've documented removal of the NG tube, this would conclude my NG tube checkoff.